We're going to talk today is about uh, psychiatrists in maybe 20 years ago, 30 years ago. When we started MD psychiatry, we got, pure cases of schizophrenia, fully formed delusion, hallucination, everything, depression in all its form, total florid suicidal ideation. And uh, everything was fully baked. So DSM, ICD criteria, all were fulfilled. And then we said that we are getting people, we are catching them too late. So then the psychiatrists all over the world, they started a campaign in which they said, let's catch them early. So they said, let's spread awareness about they're coming late because they don't know what are psychiatric symptomatologies. I mean, how do you identify it? And in the world, when they started this, it was a big task. But fortunately, what happened is though though maybe 10 to 20% of the psychiatrists were actually very actively involved in this. But the 10 to 20% psychiatrists, I think they created a 2000% magnitude impact. And the result which we see now is we're getting people very, very early. So getting them early means morbidity decreases. You have somebody who's already attempted a suicidal attempt twice and then comes to your third time. तो ये तो बस आपकी किस्मत है कि वो थर्ड टाइम आ गया, नहीं तो वो दो बार फेल हुआ, could have easily passed. And this is one of the tests which you don't want people to pass. You don't want the attempter of suicide to pass. So this is where failing is also good. दाग अच्छे हैं तो failing अच्छा है. But anyway, अब जो early awareness जो awareness पैदा करी गई, detection जल्दी हुआ. Now people are coming early, morbidity is less, everything is less, but the problem is the presentation is now different. In most of the psychiatric OPDs, in those cities in which there is psychiatric awareness, the uh, the presentation coming to the OPD is very, very different. But are the residents being trained to detect now this newer presentation? Because it is the psychiatrists, all the consultants, including me, maybe they are carrying on the same way. I did psychiatry this way, I was taught this way, so that's fine. But then the presentation is now different. So that is why the revisiting psychiatry says we have to update ourselves and then keep evolving. So the update involves we ask ourselves in all the medical colleges of India, which have a department of psychiatry, we ask, are we actually able to diagnose these new set of subjects coming to us? I didn't say patients, I said subjects deliberately. So if you get something like depression, now depression 15 days, now the psychiatrist hears depression, yes, 15 days depression, sir, major depression. The catch here is that it should be pervasive, it should be persistent for those 15 days. It should make an impact for those 15 days. It is not that out of those 15 days, he has had it for 5 days. That is on and off. So the whole criteria of major depression, as the resident should understand it, is it is a pervasive feature. The reaction or the response should be very minimal. So if there is a good response, if there's a good environment, you're able to respond well. If that is there, then you've not slipped into major depression. And when I talk about major depression, I'm really trying to highlight the biochemical nature of depression. We need to understand that depression is not just biological, it has got a psychological theory, so it has social permutations also. So we have the psychosocial biological model. And once we understand that, we understand this complete as a patient. It is said we don't we don't try to understand the disease. We try to understand the person. And this is where uh, this presentation today is going to cover that. Like, how do we identify? Most of us, we find that they're not fitting it into that box. It is not pervasive. But because we don't know how to deal with it, so we say, ah, pervasive, it's pervasive. हाँ 2 हफ्ते से है ना लगातार. So it's suggestibility. हाँ 15 दिन से है ना. Now the patient says, doctor is saying, so I should say yes. So consequently, it becomes a iatrogenic diagnosis. It's a iatrogenic fallacy. So let us try to understand how to deal with these people, how to understand these people, how to detect these people. And you're going to say, oh, we're talking about a OPD setup, and you're talking about understanding, detecting, and all. We don't have time. So I understand. I'm also a very senior psychiatrist. I've been in the business for a long time, 35, 36 years. I understand that. So we are going to take care of that. All of the presentations that are going to be made will tell you about the OPD setting. And I'm very, very happy that there are a lot of very, very young, budding people who are very, very interested in mental health, and they're doing observership in the department. Can you just join? And is the presentation is the presentation visible?
Uh, no, sir, not yet as of now. I think.
Okay. Okay. Right. Is it now visible?
No, sir.
Okay. Is it now visible?
Yes, sir. It's visible.
Yes, sir.
Fine. So Ashwarya Lakshmi has done a brilliant job, and it's over to her. She's seen some subjects, and the topic is mapping minds and stress, a comprehensive domain-based approach to mental health. Over to Ashwarya.
Thank you so much, sir. Good evening, everyone. I hope I'm audible.
Yes, you are audible.
Thank you. Good evening, everyone. I'm Aishwarya Lakshmi, and I, along with my fellow speakers, we are doing our observership under the guidance of Professor Sanjay Gupta, sir, and in the Department of Psychiatry, Trauma Center, Banaras Hindu University. So today we will be talking about the um, stress management in youth, and also we'll be talking about it based on a very innovative model that is developed by our esteemed professor Sanjay Gupta sir. Let us begin with it. So the next slide. Let's begin with the case vignette. So here's the patient profile: an 18-year-old male who presented with complaints of headache, head heaviness, excessive mobile phone usage, and after inquiring, we came to know that there was this digital usage included intensive gaming and other content consumption like pornography. So the patient also reported increased worry regarding academic performances following upon further inquiring. We came to know that there's no history of substance use or any significant psychiatric illness in the family. So with this, I we can move on to the students' stress. So what most of us think of is the area of stress that the area that generates most stress for students is educational domain. So so the next slide. The educational domain, and there are various sources of stress for the students. So it could be of cognitive nature, so we could have issues with concentration, comprehension. There could be fear of future. There's academic pressure that is very prevalent in today's scenario, given the stress about the studies, the importance one assigns to their academics, and the fear of intense competition that exists in today's scenario. So there is extreme there's also exam anxiety. That is a very common term for all of us, and we are all quite acquainted with it, and which includes there's this fear of exam. There is restlessness before attempting or appearing for an exam, and then you also have this apprehension regarding the performance that we are performing, we of how we will be performing in our exams. There are also certain external influences that do bother the students in today's scenario. So we that could be the teacher, that is the strained interaction that exists between the teacher and the pupil. So that relation could be stressful in itself for some people. There is the responsibility aspect. So how much, the degree to which we are able to fulfill the responsibilities, the academic responsibilities that are assigned to us. And then there are certain institutional demands wherein you have to perform in certain ways, and so those add to the already existing ones. So in this case, if we look at this patient, we find that the education domain specifically, like, it is very high. It is around 82%. So we while using the STQ scale, we tried to find the areas, we tried to inquire the areas that were where the stress manifested. So we came to know that almost all the areas were affected, and
No,
there were
you
some areas
you
that were
initially you initially talked about
yes,
the educational domain. So
yes.
you're saying that the student only has the educational stress.
No, sir. Yes, that was taking me to the next part. So,
Okay.
this is not just the only domain or the area where the stress manifests. So because a student doesn't exist in isolation, and they are also part of the society functioning in it. So there are various aspects to various areas in which the stress manifests. So the next slide. Yeah. So that takes me to touch the mood and thought domain in a very brief way, in a very brief manner. So we can look.
what is this mood and thought domain?
Yes, sir. So mood and thought domain is basically the emotional experiences, the stresses that are related to the emotional experiences, the self-perceptions that the person has, and the various patterns of thinking that actually leads to distress in a person.
Oh, you have
So,
it on your slide, right?
yes, sir.
You have it on your slide.
Um, yes, sir.
You have it on your slide, right?
Yes. Sir. So the feelings of worthlessness, the dark future. So it could be of depressive nature. It could be cognitive related. It could be emotional vulnerability the person is prone to. There are also certain critical aspects, indicators like the tendency to self harm. There is a dark future. The future seems grim and hopelessness. This is what I would, and this would be further elaborated by Shailaja. Next slide. Next. So again, we see that mood and education domain, but then again, is this enough? Is this all that we're talking about? Well, no. If we go to the next slide, we see this complete SSDQ profile of the individual, wherein we see the stress loading in various areas. So here we can see domains affected include physical, personal, interpersonal, social, behavioral, familial, stress coping, and educational, all of which will be explained later. And we can see the cumulative stress loading is very high,
Very,
561.
very, very high.
So yeah, so it's extremely high, and we can see the amount of independent stressors we have here. So
It's all
what
looking very,
we
very red, 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 red. It's like a danger, danger. Why
yes.
this red? Why this red? What does it denote?
Yes, sir. So the red lines that we see here in the graph, they denote the areas that need to be looked at, the areas where the intervention should be targeted. And so basically, this is we have a 40 base where the vulnerability, the point of vulnerability increases. So from the 40% percentage in the x-axis, sorry, y-axis. So all of the stress loadings above 40% is the sign of danger and needs to be intervened accordingly.
Oh,
And
so
the
the red is danger, danger, danger zone.
yes,
Okay, okay, okay.
yes, sir.
Please continue.
So
Okay.
there are certain independent stressors, and the best use of this independent stressors is we categorize these stressors in a manner, in a way, so that we can customize the intervention for the individual. So here you can see for my patient, I have categorized into three categories: the bodily reactions, the internal cognitive emotional state, and the inability to manage the external demands and the extra environmental pressures. So our intervention should be targeting all these areas in order to have a better outcome. So thank
Fine,
you.
fine, fine. Thank you very much. I'd like to now invite Siddhi after a very potent description of a subject by Aishwarya Lakshmi. Uh, she observed that during the OPD, and she helped formulate the whole graph. So, Siddhi, are you with us?
Yes,
Siddhi
sir.
Shri.
Yes, sir.
We call
Good evening.
Siddhi Shri SS. We had another Siddhi, so she was Siddhi Gupta. So we used to say SG and SS. So Siddhi Shri, yes, over to you. Interpersonal domain. What is
Yes.
this domain?
Sir, technically, interpersonal domain deals with the relation between people, how a person might perceive, how they might interpret the thoughts, the feelings, the intentions, and the actions of other people during an interaction or in a particular social setting. So it's better that we try to understand this domain with an example of a case. Can we have
Okay.
the next slide, please? Okay. So in this case, like you can see, There is a 23-year-old female, a college going student, and her interpersonal domain is affected. Like you can see, there's a red line. Like we talked about the red line being a danger. So this shows that in her life, the interpersonal dimension is affected by stressors. And this raises a question that what might be the causes or what might be the stressors which are causing this. So let's see that. Let's move on to the next slide. So there are many sources of interpersonal stress, but to understand them better, it's better that we look at the broader categories or the groups of those stressors. The first is relational instability and active conflict, where the person might say that they are having frequent arguments, their relations with other people are very stressful, or they have issues with their romantic relationships, or they might even quote certain instances like breakups or a friendship ending, or that their friendships are rather short lived. Then there's also the social devaluation and mistreatment, where people might say that they are ignored, neglected, or looked down upon by other people, that they do not respect, that the other people do not respect them enough, or that they are being harassed, or they're being mistreated by other people, or that other people are hostile towards them. There's also a lack of adequate social support, where a person might say that I have very few friends, or someone might say that I have enough people around me, but those people don't help me enough, or that they do not understand me enough, or that I as a person find it difficult to trust other people. So
हमें कोई
these,
समझ नहीं पाता है, हम हमारी कोई बात सुनता नहीं है, हमें कोई
yes,
समझ नहीं पाता है. Lot of people come to us like
yes,
that, but we
yes,
cannot fit them into any major depression. कौन सी गोली खिलाओ, कौन सी this thing. So it's basically about interpersonal stress, I suppose.
yes, sir. Yes,
Okay.
sir. A lack of social support that a person feels. So
Okay.
this is total of sources of interpersonal stress. Can we have the next slide, please? So this is the complete picture, because interpersonal stress does not always exist in isolation. There are also other domains which are affected. So in this particular case, we see that the behavioral domain is also affected. The educational domain is also affected. And the cumulative stress loading of this particular patient is 366, which is high. And there are also independent stressors or aspects or causes of so many stress that they are feeling. Now, these independent stressors may not always be a part of the domains which are affected. They can be a part of domains which are not affected. And in total, in this case, we have 21 independent stressors. Now, it's not possible for us to deal with every single independent stressor individually. So, what we
What is this? What is this independent stressor? I mean, stressor as stressors. So are you saying that the others they are dependent on various things and they need not be taken directly for intervention? I think what you're trying to say is the independent stressor is a stressor which needs independent and individual attention.
yes, sir.
All right. So, like in this, you had something like you mentioned breakup, friendship ending, short-lived friendship, arguments, losing
Hmm.
temper. So this sort of thing, all of these are independent stressors.
Yes, sir.
So they would require therapy, like psychotherapy,
Yes, sir.
to overcome it. Okay, so
Yes, sir.
it's quite. I mean, you mentioned 21. Maybe it will
Yes,
take 1 or 2 years because you cannot work on many items together.
yes, sir. That's
This
that's
this
not
was
that's very difficult.
this was the stress mapping of that individual.
Yes, sir.
Oh my God. Okay.
So what we did instead is we try to cluster them,
Okay.
the stressors which are related to one another in one way or the other. So in the first cluster, we have relational conflict. Like we talked about, because we talked about interpersonal domain in detail, it has most of those independent stressors and also others. Like there is stressful relation, there are arguments, there are breakups, or not being understood or helped by others. There is also ineffective communication. There is also the person reporting having fear of the teacher or having stressful relations with the teacher. And the person also reported physical abuse. So these come under relational conflict. Then we have the second cluster, which focuses on the cognitive issues which affect the person's daily functioning, or like we say, routine functioning. So the person is inability to do their day-to-day activities. The person is unable to fulfill their duties or responsibilities. They are not able to perform well in academics as well, or work-related responsibilities. And they find it difficult to concentrate, to comprehend. There are also two more clusters which we have created. Okay. So the third cluster is the stress-based cluster. Here we have all the independent stressors, or all the causes of stress which are related to stress or the physical manifestations of stress. For example, stress itself is a part of this. There are times when the patient feels that the situations are beyond her control, or she also worries about her past a lot. And she also reports the physical manifestation, which is tension headache, that she reports that she feels headache due to stress or tension. Then we have the fourth cluster, where we focus on the affect related issues or the behavioral issues. Now, the person says that I lose temper easily, that I get aggressive at times, that I frequently change my mind, or my mood keeps changing. And she also report having a certain addiction, which was, in this particular case, it was caffeine. So this is the management plan. These are the clusters.
So during your interview, the person told you these things, that he gets aggressive or loses temper. So
No, sir.
then how did you come to know this?
Through the SSDQ, which was given to the patient, and she answered on all these domains. And through that, we were able to figure out that, okay, these are the particular independent stressors, or these are the areas which need to be looked upon.
Okay, so it is because stress is very individualistic. So was it self-rated? Did the person report themselves, or did you interview?
Sir, it was self-rated. She did it by herself.
Self-rated. Okay. So self-rated,
Yes,
then
sir.
you can tap the individual stress. But how long
Yes.
did it take the person to fill this SSDQ test? Because many people say we don't have time and all that stuff. How long did it take for
So
the
it takes
person? I think there are 93 items, so must have taken maybe 2-3 hours or
100.
something. How much time did it take? I think Siddiq,
In this case, around 20 minutes to fill the entire
20 minutes only 20 minutes. Okay. And in between,
not more than 20 minutes.
okay. I have another question for you. I'm sorry. In the back one, you said about physical abuse. How did you come to know that
Yes, sir.
this physical abuse? How did you come to the people? People don't tell it.
Sir, it was in the SSDQ. There was a particular question regarding that, have you faced any form of physical abuse? And there
Oh,
she stated that,
okay.
yes, I have.
Oh. So that means it's very secret. So this
Yes, sir.
the test the result that you have, this must be very confidential.
Yes, sir.
Okay. So please carry on.
So this is
So
where I end my
thank
discussion
you,
of the interpersonal domain. Thank you, sir.
thank you,
Thank
Siddhi
you,
Shri.
everyone.
I had a lot of questions for you. I'm sorry, and you were very nice slides, and very it was very well explained. Also, trying to understand the whole geneza. I think in the various all the medical colleges of India in which there's a psychiatry unit, I think this can be easily done, adopted. So thank you very much. And
Yes,
can
sir.
we invite Mansi? Mansi is with us. Mansi Khanna.
Yes, sir.
Yes, Mansi, can you put your video on if you can? Otherwise, you can continue. We have your slides.
Sir, my video is on. Am I not visible?
Not a problem. Continue. You're going to talk about the physical domain. I think you have a lot of
Okay.
domains that you are talking about,
Yes,
that
sir.
these are stressors in various life domains, what we call the daily life stressors affecting the different domains
Yes, sir.
of life and different dimensions of life. That's right. Right. You can keep your video off. I think there's some connective problem. When you put your video off, then you'll have better connectivity. So Mansi is essentially talking about the physical domain, and uh,
Sir, am I audible and visible?
yes, Mansi, you are now audible. You can put your video off. That will give you better
Okay, okay, sir.
that'll give you better connection. Yes.
Okay, sir.
Please go ahead.
Okay, thank you so much, sir. I am Mansi and I'm currently doing my master's in psychology from Banaras Hindu University. Today, I would like to highlight the physical and behavioral domain. Before starting this, there are multiple times when a patient reaches to the OPD, to the hospital with n number of physical health issues, and at that time, there are times when all the underlying causes of those physical issues are being ignored. So can we please move on to the next slide? Uh, to highlight this, I would like to bring a case of 25-year-old female which appears to the department with a lot of physical health issues. As everyone can see, she has scored almost 75 in the physical domain. But is there more to the picture? Are other domains also get affected? Also, if we see that the behavioral domain of this patient is not being affected. But before moving on to what are other domains that could be affected, we should know that what the physical domain and the behavioral domain actually mean. So can we please move on to the next slide? The physical domain actually captures the somatic symptoms that a person experiences. It contains all the and the physiological symptoms that a person reports that they are going through. Sir, can we please move on to the next slide? It contains various symptoms. The first symptoms are autonomic arousals, which contains the activation of autonomic nervous system, where a person experiences maybe palpitations, tremors, dry mouth, and even dizziness. The next is the musculoskeletal stress, which contains the physical strain and tension in the body's muscular and skeletal system. It contains the tension, headache, and body ache. Also, the third is very important, the biological disturbances that a person experience. It is a disruption in the natural normal biological functioning of an individual due to various stress that they are going through. It may include fatigue, sleep issues, libido changes, as well as the digestive issues. Now, moving to behavioral domain contains how we react explicitly, or how we behave when we face certain stressors, or in general in daily life. These behavioral domains can be externalizing, which is projected outwards, or can be internalizing, which is directed inwards. They are often There are times when the behavioral domain is often being misunderstood as a loss of control or sensory disruption, but it is not always the case. So can it there are multiple domains that can be included in the behavioral dimension. It's the first is the emotional regulation, or how a person regulates their emotions. There may be loss of temper, or the person might become aggressive. The other is the adaptive functioning, or how a person adapts with the daily environment and how they regularly functions. It may be the responsibility they carry, or maybe the fear of going out alone. Now, let's move on to the very interesting part, the full picture of this case. As
Oh
we
my
can
God.
see that there are multiple domains in the case that are affected. These affected domains include the personal, social, mood and thought, and the educational domain that are affected. Now we can see that even though the patient appeared with the physical symptom, there are multiple other domains that are affected. and we have to manage those symptoms and those affected domains as well to ensure the well-being of the individual.
So, but then
For the management,
you showed the behavioral domain. You showed that it was not very heavy.
yes,
Yeah?
sir.
And
Yes, sir.
this this graph shows a lot of. You said red is danger. It shows a lot of danger. Is it the same subject?
No, sir, it's not the same subject. The subject that this test was
No, no.
administered on.
This graph that you had shown was from
Yes, sir.
this same. You had isolated the behavioral, and in the behavioral, this is green, and
Yes, sir.
you had hidden the others. Now the others, what I am saying, all the others are so heavy that,
Yes, sir.
if you look at one of the domains, like if you just look at the behavioral domain, then you will get a wrong thought that there's no problem, there's no stress. So
Yes,
I
sir.
think from your example, I think it's very important that you look at all the
Yes, sir.
and you don't look at just one or two domains.
Yes, sir.
Right, right, right.
Yes,
So
sir. Thank you
the
so much, sir, for the
management plan.
yes, sir. Thank you so much, sir. Sir, as you told that we have to look on with the entire picture, and now moving on to the stress management plan. In this stress management plan, we not only highlighted the affected domains, we also take all the independent stresses that a person faces, that a person experience apart from all the affected domains, because the independent stressors, as sir guided us, that also requires interventions, as we have seen in the behavioral domain. In this case, the behavioral domain was not affected, but if we see the third fearful responses, there was a dimension 48, fear of going out alone, which is a part of the behavioral domain, and that is affected, and that requires intervention, which takes months to even years to get resolved. Similarly, like that, all the other independent stressors needs to be addressed to ensure the well-being of the individual. Thank you
So
so much, sir.
thank you very much, Mansi. You showed the graph that you showed. Uh, this subject, when the person came to you, was the person looking so anxious? Like all of these red danger zones. So lag raha hai ki the person would have been in panic. But you have said that this person was just, he's not reporting anything on the interview, and he was all, I mean, there's I have some problem. So on the interview he said that there's only some problem, but the problem seems to be very very deep, and
Yes, sir.
the cumulative stress load, you said something like 500,
Yes,
496.5 is tremendous. So thank you very much, Masi, and you've highlighted a very special feature. Thank you.
thank you
Can
so
I
much, sir.
invite now Shalja Rathi? She is going to look at another individual domain, that is the mood and thought.
Noted, sir.
Are you with
Yes,
us?
sir.
Yeah.
Am I audible?
Yeah, you're audible, you're visible also.
Yes, sir. Okay. So, good evening, everyone. I'm going to talk about the mood and the thought domain today, as sir said. And it was very beautifully introduced by Aishwarya to us beforehand as well. I'm just going to elaborate on that domain a little bit more. So, what this domain assesses and seeks to understand is how we try to how certain stressful events manage or affect our mood and thought altogether. For example, if a stressful event occurs, it could alter my thought. Basically, I could have cognitive distortion, or it could even change the outlook that I have towards life. So it would alter my thought process. Moreover, it would also alter my mood, because it could lead to crying spells, it could make me sad, or it could make me irritable. And so it basically affects the mood and thought both. So we try to understand how the stressful events or how the stressors are affecting mood and thought. Can I have the next slide, sir, please? Yes. So, like I said, we basically look at the emotions, self-perception, thinking patterns, sense of purpose and hope, and the outlook towards life, how it changes when a person is under a great deal of stress. Can we have the next slide, please, sir? Yes. So in this slide,
Can
we
you just
basically
explain? Can you just explain what? I mean, I don't understand what is there more means what? Already you have on the left you have a red danger line, and on the right you have two danger lines, but
yes,
you
sir.
blocked
Yes.
something in the middle. So
Yes, sir. I was
you're
I was
saying
trying to pinpoint and highlight the mood and thought, which is a whopping 65% in this case. She was
okay,
a patient that came in, 25-year-old female, and
okay,
she had like like you said, a lot of dangers in her graph and a lot of ups and downs that you would see later on when I show
okay,
you the entirety
okay,
of the graph.
okay.
Yes, sir. So, moving on, this slide shows us the elements that comprises of the mood and thought domain. So basically, if any of these is scored high, the mood and thought domain is automatically high, and it would have a high stress loading as well. So, what is particularly interesting about the elements that are present here is some of it acts as a manifestation of stresses. For example, sadness could be due to a direct result of the stressful events, and some can also act as independent stressors. For example, if I'm being influenced by others, or let's just say if I am, if something about my past is worrying me, so that can be altogether independent stressors as well. So it is very interesting to see the cycle and to see how they manifest and control each other. Can we have the next slide, please, sir? Yes. So here we see the holistic and the overall picture that we have of the patient. We see that like I said before, the graph has a lot of ups and downs. We see a lot of red and we see a lot of green as well. So that is why it is very important that we look at the entire picture. We see the holistic picture and not just a keyhole version or not just a particular domain. We look at the domains in the entirety. Like I said, the domains affected are listed on the right side. The domains affected are written. And the particular concept that I would like to highlight is the CSL, which is the cumulative stress loading of the patient. So this particular concept particularly stands out because it shows us the entire picture. It basically shows what level of stress the person is carrying across all the domains and not just one domain. And it is very important to note that.
No, that's fine, but I mean, it's visible that there are five domains. On the left side, the physical, and then the interpersonal,
Yes,
and
sir.
right side, the stress and coping, then mood and thought and education. That's there. So, so everything else is all the other five are in green. So green is, of
Yes, sir.
course, green is safe zone.
Yes, sir.
So I mean, what in the cumulative stress that you are going to take up, you're going to take up the five domains in the red, and you're going to add
Okay.
together. So the green ones, the green ones are fine. Those domains are fine, right?
Yes, sir. But we still take into account of these because they do have a certain stress loading, which adds on to the overall stress. So it is important that in the
Okay.
CSL we include every certain domain that is
Okay, so
there.
like for example, in your S stands for social. The
Yes, sir.
social will be about 35,
Yes,
and
sir.
similarly others will be there. Okay,
Yes,
so
sir.
the CSL is fine, but then you have I think the other important aspect is I think you have listed a whole lot of independent stressors.
Yes, sir. Yes, sir.
So what is that all about? I mean, you haven't shown that on the graph.
Yeah, so I was coming to that. That was my next point, is the independent stressors. As we see that there is a whole lot of independent stressor that was reported by the patient. It might be not it might not be that evident from the graph because we see a lot of green, but the patient did have a lot of major concerns as we can see in the independent stressors. So it is important. So that is why that just adds on to my point that we should look at the entire picture along with the what the graph conveys and what the independent stressors is giving to us, and it is important that we base our interventions on the independent stressors as well.
Okay, so what you're saying the affected domains are important. Then you said the cumulative stress load is important, in which you calculate all of the loads in the different domains. I think there are 10 domains. So all of them added together. And then you say independent stressors. So independent stressors, as I believe, are those stressors or those items which have been scored 2. I think the
Yes, sir.
scoring is 0, 1, 2. 0 is आपको सर दर्द होता है तो अक्सर is 2 और कभी कभी is 1 and नहीं होता है is 0. So if
Yes,
you
sir.
get that aksar means that pervasiveness बहुत ज्यादा है. So that means
Absolutely.
you qualify it as an independent that needs individual therapy for the individual item. Okay, okay. So you have
Yes,
in
sir.
this case there are a whole lot. I mean, this graph will be, even if we understand and we become experts in the graph, then still we won't be able to get into the nitty gritty because there are a whole lot of independent stressors and they are not depicted on the graph. So I think you have to go into that also. I think that's a very important issue raised by Shalja, that just don't look at the graph, the independent stressors, and this tension, headache, physical tension. You see a whole lot of these cases coming in, and somebody makes a diagnosis of adjustment disorder, somebody makes a diagnosis of dissociative disorder, somebody says mass depression, somebody says GAD, whereas it is not pervasive and it's basically reactive. It's basically into the reactive, but because we don't identify the stressors that are responsible, that are creating it, so we go into that box. I think that is what we have to revisit here, what Shalja has said. I think we have to revisit that. Don't put all the things in the box. Try to understand what the symptom is, what the symptom is being told. Is there any is there a stress load in the person? Because if there's a stress load in the person, then naturally, even a slight thing will lead to irritability. And this was I think this is what you were trying to say. Right. So,
Yes, sir.
Shalja,
Absolutely.
treatment plan, right?
Yes. So, as we talked about the independent stressors, so there is another innovative way as to how Sir and the team approaches these independent stressors, as in how we manage those. So, what we do basically in this concept is basically we try to categorize certain independent stressors together, such as when we give one intervention, it simultaneously benefits or it alleviates the other independent stresses as well. Now, for example, if I have I've had a category of physical manifestations of stress. Now, for example, if an intervention was given to this particular category, it would simultaneously tackle every items that is included in it, every individual stressor, and that is impressive because one sir told me that it takes about 3 to 6 months for each individual stressors. So that is a whole lot of time and effort that we are saving with some smart work. Yeah, so uh,
Great.
yeah, that
Right,
is
right.
all,
So,
everything summed up.
I
Thank you
think,
very
Shalja,
much.
I think you highlighted very major issues, very common issues, and how we have to revisit what our approach is. We're not looking at anything. We're looking for the box of the psychiatric diagnosis. We're not challenging the person. If the person says, "Yes, I've had this for 6 months," well, we're not challenging it. हाँ 6 महीने से है, so it fits you well, so it will go into GAD also, it will go into many other things, so that's all right. Then if the person is actually asked what are you really having, and then when you ask is it persistent, then the person often most of the time says, oh 6 महीने में मतलब कभी कभी होता है, वो जब हमारे वो जब पति हमारे ये करते हैं, जब हमारे बच्चे ऐसे करते हैं, जब हमारी थोड़ी फैमिली प्रॉब्लम हो जाती है, हमारे सास ससुर जब आने लगते हैं, घर में आ जाते हैं, तो बहुत टेंशन हो जाता है, और वो 1 2 हफ्ते के लिए आ जाते हैं, उसके बाद 2 महीने तक नहीं रहते हैं, फिर आ जाते हैं. सो आई मीन इट्स अ डिफरेंट पिक्चर. So we need to go deep, because it's not about finding the box in the diagnosis, it's finding about what is the real cause and then treating it. I think that's why 1/3 of antidepressants, in the antidepressants, we still say that 1/3, when we give antidepressants, 1/3 improve completely, because you take the biological causation, but the rest 2/3, out of the rest 2/3, 1/3 do not improve at all, and 1/3 have partial recovery. So that means 2/3 are not having complete recovery. And I would say that that is because of the psychosocial nature of the causation. So the psychosocial nature of the causation is not going to be altered by the antidepressants. If a boy and a girl have a breakup, uh, and they're trying to reconcile, antidepressants to both of the people will not help in the reconciliation. And this is a very strong message. And I think we will do one of these sessions on, like, irrational use of antibiotics is very catchy. I think we have to do irrational use of antidepressants. Antidepressants, they are wonderful drugs, miracle drugs, but for the right people, those with the neurobiological causation. But when you just give it left, right, center, that is irrational, and you're going to spoil the whole concept of antidepressants, and maybe we're going to get rid of them, because there's a very strong lobby which is countering these antidepressants. They're saying that they are not useful, whereas they are very vital to therapies. So thank you, Dr. Shalja. Thank you, Shalja Rathi. You are an observer with us. And now
Thank
I
you, sir.
invite the family domain is going to be taken up by who?
So good evening, sir. I'm Mrinmoy. So I'll
Mrinmoy,
be
Mrinmoy, Mrinmoy. Yes. Welcome,
yes,
Mrin.
yes, sir. So I'll be continuing with the family domain. So can we please proceed to the next slide? Yeah. So in this slide, we can see like this slide shows the graphical, representation of the familial domain for the presented case, where the case involves like a 17-year-old female college student with affected familial domain. So, sir, like here we can see that the FD score is approximately 84%,
Oh,
which is well above the cutoff line in the graph.
very
So
high.
yeah, yeah, sir. So this indicates that family related stressors, are very having a major impact on the individual's overall well-being.
Okay.
So can we please proceed to the next slide? So yeah, so this one we will see like the familial domain. What does it assesses? So like first it assesses the overall family environment. And secondly, it evaluates home life and family support. Then thirdly, screens for mental health issues such as substance use in family, and assesses financial support and communication. So sometimes we overlook the familial domain, we only see the physical symptoms that are presented in the
Yes,
patient. So it is
yes.
very necessary for us to also intervene to the familial domain, to whether the patient is having a good bond with the family members or not, or
Yeah.
whether they are able to communicate properly or not. So I will like yeah. So okay, so now let us go to the sources of familial stress. So first we have family dysfunction and adverse environments. We include such as substance abuse in family, suicide attempts by family members, and dissatisfaction with life. And again, we have financial and practical dependence. Here includes financial dependence from help from family, inadequate financial support, pocket money related issues. So people like patient, but like this patient, when I was having the interview with this patient, so she did not have good communication with the parents. So for which there was a lot of misunderstanding between the parent and the patient.
Okay.
So sorry, yes. So this is very important, that whether the patient is getting the full support, family support from the family members, like either financially, yeah, whatever, like suppose he or she is receiving or not properly. Then again
Otherwise,
we have
you're saying that if this is not done, then she becomes stressed.
yes, exactly, sir. Yes.
Okay, okay.
Okay. So again we have okay, so now this slide shows the overall affected domains, including not only the familial domain, like physical domain, which is 70%, personal domain, which is 66%, then social domain we have 60%, behavioral domain we have 50%, mood and thought domain we have 60, educational domain we have 82. So the CSL, that is cumulative stress load, is 501. So there is
Oh
very
my
high, sir.
God. Oh my God. Oh my God. And did that person seem to be in so much of stress? Was there stress on the face? Because most of the time, people say, people look at the face, and the face is, average face. Sometimes even there's a small smile, and then the person says, "Oh no, there's no stress. Oh,
Yes,
she's smiling and all." So was she in a very bad state, or was she? uh, I mean,
yes.
like usual, was she coming and only you detected this after this scale scoring?
No, no, so yeah, the stress could be also, it was seen on her face as well, and this helped us. In addition to it, we when I was talking with her, when I was having the interview with her, I could feel that she was very stressed, and I can sense that she was not having the good bond with her family members.
No, that sensing is actually very. I don't think that's a very right statement to do, because we cannot get into the person, and
Like her,
especially because we do
yes,
not know the family, we do not know the family dynamics. Our family dynamics is something, and I would advise against uh, going into such tactics, like trying to just from reading from the face, and then feeling that yes, the person is not having good bonding and all, because this can misfire, this can be very many times, this can be wrong, and only sometimes it will be very right, because the appearance of stress, the stress may be there, but you will feel that the person is stressed. But this graph means that this person should be in the ICU, because there
yes, sir.
is so much of heavy red lines.
Yes, sir.
But the person has walked in and also filled the stress test. That means that the person was good enough to concentrate and do all of these things. So
Yes,
this
sir.
is important point. Yes, very nice. And you mentioned that very severe stress is there.
Okay,
You're also
can you
going to
please?
take up stress coping.
Yes, so stress coping is. I will also do. I will go ahead with the stress coping. So, this stress coping domain, what does this assesses? Like, what do we see in this particular domain? So, like here, this domain helps us to understand, how an individual perceives stress or react to stressful situations and cope up with emotional or environmental challenges. So this is what we are, looking up to it. And like in this slide, we can see the graphical representation of the stress coping domain, and like which the person has 62% like of the stress, which is also above the cutoff line in the graph. So now heading to the various sources of stress coping domain. So first we have like stress perception and emotional distress, such as situation beyond control, difficulty in balancing life, or fearful. And then secondly, we have adjustment and environmental challenges like homesickness, adjustment issues like adjusting to a very new environment, which may be difficult for some people, like coming up to a new environment and adapt easily, and even frequent changing of room partner. And third, we have coping style and cognitive responses. Witnessed, includes witness any horrifying situations, like in their life they have, they have witnessed any of the major horrifying situations which they are not able to cope up with it, and even blame others, like they will blame others for whatever they have done. So that that shows that they have, they are facing difficulties in coping, effective
We
coping.
often, this frequent changing of room partners that you mentioned, we often see this in many universities with the people coming in that uh, the wardens say that this person wants frequent change of room partner, and so they really don't know now how to proceed, and they don't understand whether this is a part of a illness or I mean, what to do? I mean, they take it as a like an antisocial behavior, that why does a person want frequent changing of room partner? So it's more of a stress based thing,
Yeah.
and I suppose
Yes.
that that means that what you're trying to say is that that needs a stress management plan for that
Yes.
person, and that
Yes.
will be then overcome.
Yes. So now, like in this slide, we will see the overall affected domains. Not only, not only the stress and coping domains. As you can see, there are several different domains which are also affected with the stress and coping domain. So like physical domain is affected, social and mood and thought domain is also affected. So here we can see those independent stressors, various independent stressors, like which, from which we can, have a better stress management plan.
So it's quite possible that all of these things, the person is unhappy. So the person
Yes.
wants frequent change of partners. The person is not able to adjust to people just because of this very heavy stress load. And
Yes.
in your case, what you have shown is very phenomenal here, that there are many domains which
Great.
person cannot perceive just on the interview. That physical is also there, then the social is also there,
Hopefully. Mm.
then the stress coping is there, then
Hopefully, yeah.
mood and thought is there.
Yes.
So I mean, okay, thank you very much for this, and then how will you proceed? I think this is your management plan.
Sir, this is same. Yes, sir. This is same like way the
Yeah,
Selja
I
and
think
Siddhisri
I
explained.
yes, I
Yeah.
think we looked at
Yes,
that.
sir.
The
Yes, sir.
anxieties, uncertainty. You have six clusters that you've done in.
Yes, sir.
So
Yes.
the six clusters, that means you've taken up various items, clustered them together,
Yes.
and
Yes.
then you are going to give some management.
Yes, sir. So like it is easy for practical intervention, to put all the clusters together, like whichever will come hand by hand, like it is easier, to focus on that particular. As you have already mentioned, ki, like one particular independent stresses takes 6 or 8 months to
Yes, it is
to be
very
sorted out.
tedious. Yes. So if you can have multiple together, then
Yes,
maybe
sir.
in those 6 months, instead of one independent stressor going away and being treated, being
Yes, sir.
managed, you
Yes,
could
sir.
maybe have five of them being managed. So that's,
Managed together.
I think
Yes.
that's a very innovative approach, a very nice. I
Yes,
like
sir.
that thought process. I think it's very relevant, very easy. I think
Yes.
it's the right thing that you look into that. So
Okay.
very nice. Thank you very much, Mrinmoy. Mrinmoy has
Thank you,
been
sir.
excellent in his stint with us here.
Thank
And
you, sir.
Mrinmoy is, we are expecting a lot of good things from Mrinmoy when he goes into further things. Thank you.
Thank
Uh,
you. Thank you so much.
I'd like to invite Snehal Singh. She's
Yes,
from
sir.
Christ University, Delhi, NCR. I think Snail will be talking about personal domain. So, Snail, you can introduce yourself.
Yes, sir. Am I audible?
Yeah, you're audible.
Okay. So, building on our discussion, I'll be covering the remaining domains. Good evening, everyone. I am Snehal, and as a final speaker today, I'll be covering the personal and social domain. So, sir, can we move on to the next slide?
You're already on the.
The slide next to this. So now, I want you to draw your attention to the first graph on the screen. Now, this highlights the personal domain. So in this, the individual who is a 27-year-old male, we see that his personal domain is significantly affected, showing a high stress level with a score of 58%. But what exactly do we understand by personal domain? So the personal domain is how a person views themselves, manage their emotion, and handle daily responsibilities. When this domain experiences a high stress load, it compromises an individual's overall functioning, their emotional stability, and their self confidence. So, to break this down, our framework categorizes the personal domain into four key dimensions of stress. As you can see on the screen, the first is the self perception and emotional well being. So, this is about our self concept, our internal feelings. This dimension presents low self confidence, persistent negative feelings about oneself, and how a person finds it difficult to relax. The second is cognitive functioning and productivity. So, this involves our mental processes and our work efficiency. Under stress, this manifests as difficulty initiating tasks, problem in making decisions, and feeling of reduced optimum functioning. The third is behavioral responses and responsibilities. This represents how we outwardly act when we are overwhelmed. The fourth is coping pattern and external stresses. This refers to the defensive habit we use to escape tension, such as unhealthy avoidance behavior and a hesitation to seek professional mental help. So now, looking at how heavily this person's stress weighs on him, we have to ask ourselves, like, do we really think that there is only one domain of this person's life that is suffering? The answer is no. Yes, this slide. Now, sir, there a slide previous to this one. Yes. So the human experience are deeply interconnected. So when we shift our gaze to the graph, we can see that the social domain is also heavily impacted. It is representing a high stress score of 50%. So to understand this easily, we have to know what social domain is. So social domain is simply our ability to build healthy relationships, connect with a support system, and ask for help when we face problems. When this domain is highly stressed, an individual struggles to stay connected. So when we are looking closer to the graph, we have two subdivisions that are derived from this social distress. The first one is social support and assistance. This is about how the client handles external help and how under stress they hesitate to seek help from others and how they feel that the support is simply not available to them. The second is social adjustment and emotional sensitivity. This is how they react to their social environment. They are highly sensitive to social life and they easily feel distressed or discouraged by others. So now let's move on to the next slide, which shows that the whole graph of the individual. The graph
Oh my God.
represent how his stress levels in several domains, and we realize that the stress loading is not an isolated issue. There are other domains are also affected, including the physical, the interpersonal, mood, and thought spheres. So in total, the scale reveals that there are dozens of other independent and standalone stressors that are present in his life. So we have, as you can see, we have a massive list of independent stressors that are trying to we have to treat them one by one, and treating them one by one would be very difficult and overwhelming both for the client and sir. Can we move on to the
Yeah,
next
yeah,
slide?
yeah.
Try this one.
That's it.
Thank you so much.
Thank you.
So,
Thank you.
Ash,
Thank you. Thank you very much.
no, sir, there is
Yes.
still,
Snail, please continue.
yes, sir. Okay, so as we can see that our management slide, we have taken these independent stressors and grouped them into clusters that are clinically similar. So by grouping items mechanism, we can design a highly targeted intervention plan. So as we can see, the stressors are divided into distinct dimensions. For example, we have psychological withdrawal and emotional distress cluster, which has loss of interest, negative thoughts, mood changes. And we also have perceived lack of control cluster, which has constant worry, excessive worry, and fear of unknown. So by organizing the targeted plan this way, we don't need different protocols. Instead, we need one single intervention that can target and manage all the independent stressors clustered within the specific dimension. Now, this strategy ensures that our clinical management plan is structured and it is efficient, and it is enough to restore balance and to tackle both the person's different affected domains.
So are you going to, when you're going to tackle these, are you going to do multiple, multiple stressors? Are you going to take all in one?
Yes, sir. This is what like we divide the stressors into different clusters, and we plan
Right.
an intervention depend based on that cluster.
Right. Okay, we heard about the clusters. So the clusters would be similar stressors being clustered together, so having a particular common management intervention technique. Right. Thank you.
Yes, sir. Thank you, sir.
Thank you very much. I think very lucid presentations, very illuminative presentations by all. And uh, I'm quite sure that there are going to be a lot of comments. I think we have 10 more minutes. So I can invite some questions and I can invite some comments from the audience which has been connected. I'm very happy that a lot of people from all over India have connected with us. So you have to just pass on the model to your various places. Anyone would like to ask any question?
Yes, sir. Sir, I would like to ask some question. Sir, I wanted to know how does a person who is like very restless before an exam impact, like how the restlessness before an exam impact their exam performance or the result?
Okay, well, see, very nice. I mean, it's a very basic question. You're very right. Everybody has restlessness before an exam. I suppose that's what you want to say.
Yes,
Uh,
sir.
it's basically two ways. You hear about exam phobia, but actually it is a two-way. It is a bi-directional thing. How stress affects the individual before examination or during the examination. It is a bi-directional model. It is not just negative. The negative thing, everybody will tell you that the person is not able to concentrate. So if you're restless, then you won't be able to concentrate. If you're not able to concentrate, then you won't be able to retain anything. And if you're not able to retain, then you won't be able to recall. And so naturally, your performance will go down. But we have to understand the common patterns of what we are seeing. As psychiatrists, we have to understand those things which we are actually seeing day in and day out before exams. And we have given exams, we have given MBBS, MD examinations, which have been very, very heavy exams. And the whole thing is before the exam, once you are in the proper perspective that, yes, it is my time, you have a positive attitude, it is my time, I have to do it, and I have only 2 days in which I have to complete 30 chapters. Now, in average times, this is it's just not possible. 2 days में 30 chapters out of the way. No, 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 not at all. But we find that just before the exam, because of that stress, the productivity, what we read in 2 hours, in the non-exam time, we cannot read in 20 days. So it's difficult. But the cutoff is that the stress level should be balanced with a positive mindset. People have to understand that you are going to have stress and you have to convert that stress into a positive one. That when you say, your mind tells you, oh, I cannot do it. So you talk, self-talk, positive self-talk. When your mind says, oh, I cannot do it, then you say, no, I can do it. And that turns that negative stress into a positive stress, and it goes on. Thank you, Sakshi, for your very, very nice question.
Thank you, sir. Okay, I'm washing off. एक बार वो नहीं चल
Yes, any other questions?
हाँ वही देख thank you. चश्मा भी ले लो
Sir, can I ask a question?
Oh, yes, yes. Can you introduce yourself?
Yes, sir. Myself, Bhumi Singh.
Okay, okay, good.
Sir, I wanted to know what is the importance of the physical domain question in the psychological stress evaluation test.
हाँ
Okay, so who presented the physical domain?
Sir, Mansi Di.
Yes, sir.
Mansi is with us,
Yes, sir, I am here.
so you can answer that question.
Sure, sir. Bhumi, can you please repeat the question again?
contact number 790
Yeah, sure. What is the importance of the
98
physical domain question in a psychological stress evaluation test?
मम्मी का पे के हिसाब से मेरे आधे
Thank you so much
वॉलेट से
for
अमाउंट
repeating
कटे
the
ना
question.
फिर जितना
As
एक्स्ट्रा
mentioned in the presentation as well, there are many times when a person appears into the clinic, into the hospital with a lot of physical health issues. But we have to look into not only the physical stresses that they have, but also to the underlying causes of those physical stressors. Uh, and it is also bi-directional. There are multiple times when, due to mental health issues, there are physical symptoms, and as well as there are many a times
पे है
when due to
आपको
physical issues, there
809
are mental health concerns.
नहीं
So
सिर्फ उनका कर रही हूँ
it's
अभी
very important to highlight all the physical stress symptoms that a person is experiencing.
Yeah, that's good. That's good. I mean, it's very complicated. It's the bidirectional model is not very much there in that. It's more of a causation type of thing. All right. So
Yes,
thank you for your question. Any other
thank you,
questions?
sir.
Yes,
Siddhi,
sir.
Siddhi, yes, Siddhi, you are at present. Where are you? Siddhi, at present, where are you?
Sir, I am in my home, Chhattisgarh,
Chhattisgarh.
and
Okay. So, what is your
currently
question?
I'm
Yes.
pursuing course. Yes, yes. So my question observership also. I noticed frequently after uh, the patients recovered, their graphs were green. Like
Yes.
initially, domains were affected, but later there were domains affected which were none. So, are there any chances of them getting affected again like previously, or so after intervention and proper counseling,
Yeah,
there
very,
are less?
very important. Very important. I think it's a very important concept. See, we showed the pre-graphs. We did not show the after therapy graphs. And like Siddhi said, the after therapy graphs, the red danger zones are almost minimal, and almost everything has gone into the green. The cumulative stress load has also decreased, and the number of independent stressors also decreased. But again, the life is full of stress. So the stressors can come again at any time. So it is important that whatever therapeutics, whatever techniques you have learned, the subject has learned, they must continue to do that, because no one is protective. There is no stress vaccine to protect you from stress. So I think we have 2 more minutes. Uh,
Sir, can I
Ananya,
ask
yes, you have a
question?
question? Please go ahead.
Yes, sir.
Thank you,
Sir,
Siddhi. Thank you, Siddhi, for your very good question, and all the best.
my question is, how does stress influence the person's ability to express feeling and emotions?
Oh, yes, that's important. The expression of feeling and emotion. See, it alters the emotion. It alters the feeling. It's something like, you have a boy and a girl, or a husband and wife, and the person is very stressed. So the husband is very stressed, and he comes into the home in the evening, and the wife brings a cup of tea, and she's just about to bring some biscuits, and suddenly, the husband says, ये क्या ले आई हो? सिर्फ चाय पी के आए हैं, इतना थक के आया हूँ, सिर्फ चाय ला रहे. So it is, the thing has been altered, because the stress load is there, like you showed, the cumulative stress load. I mean, when the wife asks, or when the girl asks him what has happened, he will not be able to recall what has happened, because they are very daily life stressors. So they're not very noticeable, but then they add up. And this is the cumulative stress loading model that you have shown. And that is why it's important that almost everyone, everyone living life wants to go up, wants to progress, and there are a lot of obstacles. So there will be always stress. So you must keep on developing stress management techniques. And these are not, you've seen that these are not psychiatric patients, in the way that there is no axis 1 diagnosis. It is only stress induced. And consequently, with the post therapy, with the post SSDQ scores, you would have seen that they get better also, and the response is great. So that's
Yes, sir.
very important that you have to understand. And from Ananya's question, it is very pertinent that
Yes.
these techniques that you learn, the therapies that you learn, you keep doing. So it is the discipline that keeps you up. So if you are disciplined enough, then you will live life happy. But आदमी पूछता है कि खुश रहने का क्या चाहिए, तो एक चाहिए कि आप एक डिसिप्लिन अप्रोच कर लीजिए. आप 10 to 10 minutes का, 100 minutes का डीप ब्रीदिंग एक्सरसाइजेस हमारे चैनल पे है. वो एक पर्टिकुलर तरीका, हर एक चीज का तरीका है. इट इज नॉट योगा, इट इज डीप ब्रीदिंग एक्सरसाइज, साइंटिफिक तरीका. 10 मिनट्स करना है, 10 बार करना है. सोने के पहले दो 20 मिनट कर दीजिए. you'll have great sleep. Why? Because stress load will go down. एंड ये कब करें? आदमी हमसे पूछता है कब करें. भाई हमेशा करिए. भाई कब स्ट्रेस आएगा? तो क्यूमुलेटिव स्ट्रेस लोड, जैसे आपने कहा, अगर क्यूमुलेटिव स्ट्रेस लोड आपका 400 है और फिर थोड़ा कुछ आ गया, तब तो आप पता चला आत्महत्या का प्रयास कर देंगे. You may even attempt suicide because you're at 400. You're near the tipping point. But if you're doing active stress management techniques and then you're at 150 level, तो 150 level पे अगर 50 का भी stress आ गया, तो you're only at 200. So people ask me, what do I have? What is your plan for preventing suicides? So I say it's very simple. You manage your stress daily. And like we eat food daily, lunch and dinner, similarly, we breakfast, lunch, dinner, तो 10 बार नहीं तो 3 बार आप करिए एक्सरसाइजेस. बट कुछ पाने के लिए कुछ करना तो पड़ेगा. थैंक यू अनन्या, वेरी वेरी.
Thank you, sir.
So I think
Good evening, sir.
Shaurya, Dr. Shaurya is with us. Dr. Shaurya, would you like to make any comments before we wind up? Because it's been a very this thing. I think we had another question from Shrishti, was it?
Yes,
Or
sir.
yes, please. I'm sorry I stopped you.
No, sir. Why do people drink too much tea, coffee, or alcohol, or smoke when they feel stressed? And how does it end up making their anxiety worse?
Yes. You know, this drinking too much tea, coffee, these are general unhealthy stress management techniques. So actually everybody adopts stress management techniques, but something is proper, something is not. हाँ? तो कोई क्रिकेट बैट्समैन खेल रहा है, एक बैट्समैन खेल रहा है, उसकी टेक्निक बहुत अच्छी है, वो आगे कप्तान बन गया. दूसरे की टेक्निक बहुत अच्छी नहीं है, 2-4 टेस्ट मैच के बाद उसको निकाल दिया गया. So the unhealthy approaches are unfortunately highly prevalent. People are taking alcohol, 1-2 peg alcohol ले लिया for sleep disturbance, सिगरेट्स ले लिए. कह दिया, देवानंद साहब कहते हैं मैं जिंदगी का साथ निभाता चला गया, हर फिक्र को धुएं में उड़ाता गया. तो अगर देवानंद साहब कर रहे हैं तो हम कर रहे हैं भाई. अब प्रोफेसर संजय सर कह रहे हैं ये गलत है, भाई क्या गलत है, मैं करूंगा. तो आप करिए ना करिए, तो भाई इट्स अ फ्री कंट्री. इंडिया इज it's the best democratic country in the world. So you can do whatever you want, but I would really request everyone that consider your health to be very precious. And if you do good things, your health will be good. If you do bad things, your health will be bad. We are responsible for our health. We are responsible for ourselves. And what is said is the best thing about behavior is we can understand what we are doing wrong and we can change it. It is in our hands. So, I mean, decide to change it, have that motivation. I think revisiting psychiatry is also not just talking about it, it's also trying to convince the people that be motivated to keep changing yourself And reinventing psychiatry is not just for psychiatrists. It is not just for mental health professionals. I think it carries a bigger message for the whole community at large, that stress is real and it adds up and you can really hurt yourself. So start managing your stress, which is going to be good for you. It's going to lead to you being better. It's going to lead to your family being better, and it's going to lead to the nation becoming better. विकसित भारत खुशहाल भारत भी होगा. और खुशहाल भारत और विकसित भारत में वही बात है अभी जो हम लोगों ने कहा, स्ट्रेस जब ऑप्टिमम रहेगा तो विकास होगा, और स्ट्रेस जब टॉक्सिक होगा तो विकसित भारत का सपना भी बस एक सपना रह जाएगा. We must go towards fulfilling the ambition for the country that our Honorable Prime Minister Narendra Modi ji has. He is a visionary who looks for the welfare of the community at large, of the whole country, and not only of the country. He is a massive following in the world also. But we need to realize, and governments need to realize, that unless the mental health angle is incorporated with the proper experts taking part in the show, the dream of Viksit Bharat and Bharat being Sone ki Chidiya again may just have difficulty in being fulfilled. So thank you. That's a very nice question, Shrishti. Over to you, Shaurya. I took over from you because you're a bit busy today, but next episode you'll have to take over again.
Sure, sir. So, yes, sir. So, with the time constraints, we would definitely like to thank all the participants who put in their efforts and on the slides and discuss the individual domains of the tool that we have been discussing, which is helping us to revisit important concepts. And then we have Sir with us who keeps on guiding us, and throughout the discussion, he kept on asking questions wherever we had doubts or wherever we were finding some issues. So thank you, sir. Thank you for conducting the session so nicely. Although it took quite a bit of, like, it was quite lengthy, but still you were totally involved for the end of the discussion. So with this, we would like to conclude the session, and we would be hoping to meet you again on the in the next month, second Wednesday. So yes, sir.
Right. Thank you all. Thank you, Shaurya. And thank you all for joining. Let us reinvent and revisit all the phenomena. And I wish all of you, the budding young mental health professionals of the country, the very, very best. And from your presentations and from your things that you presented, it is quite evident that the future is very, very bright and sparkling. Thank you. Good night, all. Thank you, Nilaya, for joining. Nilaya is in Bangalore. She is always regularly with us. And thank you, Nilaya, also for joining. Thank you. A lot of consultants joined. And I'm sorry, it's short of time to take their names, but thank you very much, the big consultants. And till we meet again, all the best.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
ये कौन बोला है?